No further disruptions. Our next witness is Dr. Aseem Malhotra. Dr. Malhotra is a multi-award-winning, internationally renowned British cardiologist. He served in an advisory role for health policy across governments, including as an ambassador to the Academy of Medical Royal Colleges and trustee of the King's Fund, a health policy think tank. He was ranked the #1 doctor in the world influencing obesity thinking, and was named one of the UK's most influential scientists. Dr. Malhotra.
Thank you, Senator Johnson. In January 2021, indoctrinated with the unlikelihood of any major harm, I took 2 doses of Pfizer's mRNA vaccine, unaware at the time that it was, in fact, a prophylactic gene therapy product and unlike any traditional vaccine. Although I was at very low risk of serious illness from COVID-19 due to my age and perfect metabolic health, I was inoculated to protect my patients. As one of the UK's most trusted doctors, I was requested to appear on Good Morning Britain to help tackle vaccine hesitancy amongst high-risk ethnic minority groups. 5 months later, a personal tragedy triggered a complete U-turn in my perception of the vaccine. We were dealing with a medical product that was actually unsafe and defective. My fit and healthy 73-year-old father, Honorary Vice President of the British Medical Association, who also happened to be my best friend and last surviving member of my immediate family, died after suffering an unexpected cardiac arrest. Post-mortem findings revealed severe coronary artery disease, and subsequent published mechanistic evidence suggested that 2 doses of the mRNA COVID vaccine likely caused a massive acceleration in atherosclerosis, leading to his sudden death. In 2022, I published a 2-part peer-reviewed paper in the Journal of Insulin Resistance calling for a moratorium on these unsafe and defective products. The most damning evidence was a reanalysis of Pfizer and Moderna's original trials. It determined a frequency of serious harm from the product that was 2 to 4 times more likely than being hospitalized with severe COVID. In my view, if the system had been more transparent, this prophylactic gene therapy would likely not have been injected into a single human being in the first place. Although there is now a multitude of high-quality research supporting those analyses, there's been predictable little to any mainstream media coverage, a symptom of the downstream effects of how big corporations exert their power by controlling the dominant narrative. I have personal experience with these downstream effects. Towards the end of last year, at the Reform Party political conference, I quoted Britain's most eminent oncologist, Professor Angus Dalgleish. He believes that the COVID mRNA vaccine likely played a significant role in cancers of members of the royal family. Predictably, I was smeared and misrepresented in the media. Even the British Prime Minister, Sir Keir Starmer, misled Parliament, suggesting that I'd claimed that all vaccines cause cancer. In quotes, "These dangerous conspiracies cost lives," he said. I also experienced public smears and attacks from influential sections of the medical profession. I'm a grieving vaccine-injured doctor. I've been diagnosed with a persistent autoimmune condition related to loss of bifidobacteria in my gut, and advanced blood tests suggested I'm at slightly increased risk of cancer in the short term. Looking at the totality of up-to-date evidence and what you've heard from eminent witnesses today, in my view, millions of Americans and millions more across the world may be in clear and present danger of suffering premature cardiovascular disease and cancer. Without allowing all scientists to debate this openly, without fear of censure, we will not be able to identify who is most at risk and how these risks can be mitigated. When it comes to making money, multinational corporations have been diagnosed by preeminent forensic psychologist Dr. Robert Hare and law professor Joel Bakan as legal entities that fulfill the criteria for psychopathy. Characteristics include callous unconcern for the safety of others, incapacity to experience guilt, repeated lying, and conning others for profit. The evidence presented here today exposes the corporate tyranny underlying public health practice. This profitability over people rooted in the neoliberal economic model has led to trust being an all-time low in the medical profession. A full public apology from government bodies and medical leadership to the vaccine injured and bereaved is an essential first step in restoring that trust. Tyranny emerges when people are afraid to say what they think. When you have something to say, silence is a lie. When everyone lies all the time, the tyranny is complete. To save the health of the American people and to save democracy, it is our responsibility to expose, resist, and dismantle the era of corporate tyranny we currently find ourselves in. Thank you.
Thank you, Dr. Malhotra. Our next witness